This is Tar Heel Talk, an in-depth look at the issues and people making news in North Carolina. Here's your host, Sonia Williams.
Residents of North Carolina are 20 to 40% more likely to die of stroke than those living in other parts of the country. And while stroke awareness campaigns are important to help educate the public about symptoms and the importance of getting to the hospital quickly, patients and healthcare providers believe that what happens after stroke patients leave the hospital is just as important as how quickly they arrive. And now, thanks to a multi-million-dollar grant, stroke patients across the state will help determine whether long-term post-stroke care improves their daily function. And joining me now to tell me more about this study is Dr. Carmelo DiGrafnino, and he is the director of the Duke Comprehensive Stroke Center. Thank you so much for being with us.
Thank you.
When you hear the statistic that North Carolina residents are 20 to 40% more likely to die from stroke, that is frightening. Why are North Carolina residents so susceptible to fatalities as a result of stroke?
Well, we live in the southeastern part of the United States, which has been termed the stroke belt of America. And within the stroke belt, North Carolina sits in the buckle. So if you look at I-40 and 95 intersection, is the epicenter of vascular brain disease in our country. The reasons are multifactorial. We have a large amount of hypertension, diabetes. Smoking was traditionally a very heavy risk factor, which is thankfully is improving. And then our cultural makeup of a large proportion of African American and Latino populations, which genetically already have a higher tendency towards hypertension and diabetes, further complicates the picture. We're a very rural state with also suboptimal access to healthcare. So when you take social and biological factors, it plays into us having some of the highest rates of stroke in all the United States.
And when you talk about the numbers and how stroke is impacting people here in North Carolina, what are you seeing coming into the Duke Comprehensive Stroke Center in terms of who's being affected by stroke and their ages and circumstances surrounding that?
Well, whereas a lot of people traditionally have thought of stroke as something that happens to your grandparents, it's actually not a disease strictly of the aged. In our hospital, just in the last year, we have almost doubled the volume of patients that are coming in with stroke. Some of this is due to increased outreach and having some very exciting therapies that have just come out over the last year. But at the same time, as our population is aging, we're getting into higher and higher stroke rates. We've seen patients as young as 18, 19 years old on the adult stroke service, into their 80s and 90s. Even currently right now, there are multiple patients in their 20s and 30s. So something that we really reach out to the public is that if you're having symptoms as maybe referable to stroke, weakness, numbness, speech problems, just because you're young does not mean you're not at risk for it. And so we are encouraging everybody to be aware of this for themselves and their family. So it can be seen in their 80s and 90s. It can be seen in your 30s, 40s, and 50s.
Wow, and that is important for people to know the signs and the symptoms of stroke. Why do you think we're seeing so many young people now being impacted by stroke?
Unfortunately, as our population demographics have changed, we have an epidemic of diabetes in our country, obesity, hypertension. We've also had more difficulty with patients adhering to medications due to economic reasons. And some of the lifestyle choices also play into the disease called vascular disease. The alcohol consumption, cigarette smoking, and in the very young, something that is underappreciated is the effects of drugs, particularly cocaine, which it's not something that you just get away with. And we've seen a significant number of brain bleeds in association with those drug uses. So again, very important for people to be aware of the impacts of their life choices. as well as the genetics that they happen to have inherited.
Absolutely. Now, I understand that there is the COMPASS study that will be taking place, or that's taking place now. Tell us a little bit about that study and what it entails.
This is a very exciting project because over the last half decade, we've had an enormous amount of effort put into the early phases of stroke treatment, which obviously is extremely important because we need to open those blood vessels as quickly as possible. But something that was underappreciated till a few years ago was that after great successes, such as acutely treating a stroke and opening up the artery, you have to make sure that patient can get back to their home environment, to have the resources they need to rehabilitate and the medications they need to, so it doesn't happen again.
Right.
And so secondary prevention, making sure that we provide the best practices. So we looked at this a number of years ago in a collaborative effort with many of the investigators that are part of this project to see, was there in the literature proof of what would be the best things to do so that we could just do it? How do we get patients out of the hospital back home in the most effective way to improve their health? And after reviewing thousands of papers, we found that there was very little to no scientifically proven best method of preventing stroke and preventing it the second time around by providing the right community what we call transition of care. So the project that Dr. Duncan and the group at Wake Forest and the folks from UNC in collaboration with a number of centers across the state are doing is evaluating whether a very structured tool used from the time the patient is ready to leave the hospital with an intensive early communication of the patient, phone calls very quickly after they leave the hospital, a return back to the care provider, the stroke team, within that first week, with a application that is iPad based, so that smart based, so we can say what are the resources that are available in that community to that patient. If that intensive pre-planning and early follow-up and optimizing community resources, will that provide the infrastructure so the patients can get their medications correctly, can get the support they need in therapy and in their home, and with that structured approach, will those patients be less likely to re-stroke or have other medical complications compared to the physicians having best hopes for the patient, discharging them and saying, well, we'll try and get you back sometime in the next few months. Please go see your primary doctor. And assuming that the primary practices, which already have very large volumes of patients, can deal with the complex issues that involve this transition. So this is a very novel and well thought out project that we're excited to be part of in trying to support proving that this in fact is a standard that this country should adopt. So this could change healthcare across the United States.
Absolutely. Very exciting possibilities. When you're looking at this effort and this study, you're taking or partnering with hospitals across the state of North Carolina?
Yes, this is looking at everything from large academic centers like Wake Forest University, Duke, UNC, Carolinas, to the very small hospitals out on the coast or in the small communities. So the invitation that's going out to be part of this is for physicians and hospital administrators to be proactive and realize that by supporting this kind of work, not only do they potentially help their patients, even if this is a randomized study at first, so we're going to compare one approach to another. But the beauty of research where everybody participates is that the sooner we get an answer, the sooner we can move forward with best practice. So we can continue to guess what the right thing is for the next 10 years, or we can collaborate on this project as we do with other research studies, get an answer, and then adopt that. So that's kind of the goals of our colleagues that are running this program, and we're supporting them for that reason.
Definitely important work. We're going to take a break and we'll talk more in just a minute. We'll be back with more on the COMPASS study after these messages. Today we're talking about a 5-year study called COMPASS, or Comprehensive Post-Acute Stroke Services. The study will compare patients who receive existing stroke treatment as they are discharged home to patients who receive comprehensive stroke services once they return home. And with us again is Dr. Carmelo DiGrafnino, and also joining us is Gladys Lundy, who is president of the Minority Women's Health Project and also Triangle Stroke. Thank you so much for being with us.
Thank you.
We're talking, Gladys, you are a stroke survivor.
I am a
and
stroke
have been a huge advocate for education and awareness about stroke. Talk a little bit about your role in this study and your outlook as a stroke survivor.
I am so excited that PCORI granted the funds to Wake Forest University Hospital to do this study because I am one of those patients that they will be looking at. I had my first stroke, mini stroke, in 1999 and my massive stroke in 2000. Wow. And it left me incapacitated for 4 years, 4+ years in a nursing home. And I think that I would definitely have benefited from a program such as this. It allows me to hope that in the future that this will be in place for all other stroke patients or those who have just had a stroke or leaving the hospital system. Right. It's an opportunity for the hospital to better track that recovering stroke patient by following up. And I think that's good. It's something that doesn't exist in North Carolina. Of course, the hospitals have their own standard of care and contact with the patients and sending all the necessary information to their private, their practitioner. But this is an extra step to have in place. And it's going to be beneficial for the hospital systems. It would be beneficial for the stroke patients like myself. And it's going to have a real impact in healthcare. And as a follow-up, you know, I'm hoping that once this study is completed, that it will serve as a model for other states to develop something similar to what we will have in place here in North Carolina. I was listening to a program last evening, and they were talking about the surprise that they have when they just a group just commonly went onto the street and asked the regular passerby, do you know anything about strokes? Do you know how you know that you've had a stroke? Do you know any of the symptoms? Do you know any of the risk factors? And they were just amazed at the lack of education. So considering that is that case, we want to make sure if that individual or those individuals have a stroke, that at least there's something in place better and a follow-up program that will help them.
Absolutely. And Dr. Raffanino, as we were talking before the program, May is Stroke Awareness Month, and it is a good time to remind our viewers of the signs and the symptoms and maybe some of those risk factors. So can you talk a little bit about that? And I think this is an appropriate opportunity to educate the public and remind people to look for those symptoms.
Absolutely. As you can appreciate, there's as many stroke symptoms as there are parts of the brain, but one of the campaigns that the American Heart Association has really been working with, and we would challenge the public to join us, Duke, we have started what we call Think Fast and Pay It Forward.
Okay.
And so FAST is face, arms, speech, time to call 911. So if you see your loved one or friend with numbness of the face, drooping of the face, slurring of the face, weakness of the arm or leg, difficulty with speaking, that's the S, then it's time to call 911. The reason we encourage 911 is because we have looked within our health system as well as nationally, and on average, patients that come to the emergency department with an acute stroke by ambulance are treated 20 to 30 minutes faster than those that are driven in. Usually what happens is the ambulance attendants get a chance to pre-call the hospital, give us a notice they're coming. For every minute that we don't open up an artery in the brain, we lose 2 million brain cells. So we can't afford 30 minutes of somebody waiting to come in.
Right.
And why we call it think fast and pay it forward, it came because my wife's favorite movie is Pay It Forward. And so we stole that idea in that we have been working at teaching somebody that you know, face, arm, speech, time to call 911, and then asking them to teach 3 people that. And those 3 people each teach 3 other people that, so that in a short time, we would hope that everybody in our state, from school children on up, recognize that when they see these things, they call 911 and get help. I think it's better to be wrong and not have a stroke than to be wrong and be missing a stroke.
Absolutely.
Things that can lead to stroke that are very important, that are modifiable. The number 1 risk factor is high blood pressure. And so we encourage everybody, and again, I have a 19-year-old with a stroke on our service, so blood pressure is not related to age per se.
Right.
And so get your blood pressure checked, get it treated. Diabetes is extremely important. Cigarette smoking is a preventable, completely eliminatable risk factor. Hypertension, diabetes, smoking, obesity, and high cholesterol. If you can manage those, and particularly no matter what age you're at, we've gone a long ways towards eliminating or reducing the risk of stroke. And then there's a host of other risk factors that are more complex, but if we could tackle high blood pressure, diabetes, and cholesterol, we would go a long ways in our state, and recognition.
Absolutely, and I think that it's important for our viewers to understand a lot of ailments are related to obesity, but hypertension doesn't always have to be related to obesity. We're talking about having thin patients who still suffer from hypertension.
Absolutely. Hypertension is a complex condition with very strong genetic components to it. Dietary, of course, we want to limit salt and all those other factors, but again, it's the silent killer because you don't know you have high blood pressure till someone checks it. There's this myth that you're going to get headaches and then you'll know, but the majority of people with high blood pressure have no idea. So again, get your doctor to check your blood pressure. There's church groups that check it. You can go to the stores and check it. You can buy blood pressure machines and check it, but have that followed up and then deal with it by seeing your doctor.
Excellent advice. We're going to take another break and we'll talk more in just a minute. We'll be back with more Tar Heel Talk after these messages. Welcome back to Tar Heel Talk. I'm Sonia Williams. Today's show focuses on COMPASS, or Comprehensive Post-Acute Stroke Services. COMPASS is a 5-year study that compares patients who receive existing stroke treatment as they are discharged home to patients who receive comprehensive stroke services once they return home. And with us again is Dr. Carmelo Grafnino, and also joining us is Gladys Lundy. We thank you both for being with us, and we've been talking a little bit about, with this being May and Stroke Awareness Month, the importance of understanding the signs and the symptoms of stroke, and then the promising future for this study in the recovery and health long-term of stroke patients. So Dr. Grafnino, talk a little bit about Ms. Gladys. She mentioned that she had a mini stroke first and then the next year had a massive stroke. Is that common for a patient once they have a stroke to likely have another one at some point?
Once you've had a mini stroke, if you're fortunate enough to get that kind of warning, it should be something that you act on immediately. That's another concerning part we have, is that many times patients will have an episode of lack of speech or numbness or weakness, and fortunately it clears up within a few seconds or minutes, and then they feel, well, I'll wait for a little while and deny to themselves that there could be something wrong because it's scary.
Right.
And then the second time or third time that it happens, it turns out to be a very massive stroke, sometimes so big that we can't do anything about it. So being aware of these symptoms, and even once you've had the stroke, you're definitely at a much higher risk of having another stroke. The main focus of our workup in the hospital setting or even in the clinic setting is to identify those risk factors that we can intervene on when it's just been a mild or warning before it turns into the unfixable stroke. And again, these are the things such as looking at your heart, making sure your valves are right, checking your heart rhythm. Atrial fibrillation is a very common cause of stroke in the elderly. Looking at high blood pressure, diabetes, cholesterol, getting on your medications. And the other important thing we ask patients to do is to be compliant with their medications.
Yes.
If there's side effects, don't just stop them. Consult your physician. Many times we see patients on blood thinners who make a decision they want to come off these and just stop it. Unfortunately, then they go on to have a stroke, as opposed to talking to the physician about whether there's alternatives they could be on that might suit them better.
Right.
So anything that happens, either a warning stroke or changes, again, we say that is as big an emergency as if you're having the full-blown stroke. Go to the emergency department if this is happening right now. If this happened a few days ago, we and other folks in our states are seeing patients like this within a day or two and undertaking all the investigations to look for those things that we could do to prevent it so we don't need Compass.
Right.
The best thing we could do, obviously, as physicians and nurse
Eradicate.
practitioners, is never need this program in the first place. And so, obviously, once it happens, we're very excited about the things that we can do to prevent another one. So even if you get home and you've done well, we don't want you to have a third or fourth stroke.
Right, right. And Gladys, what are some of the challenges that stroke survivors face after you have that first one and you're coming home? What are some of the things, and I'm sure that part of the study is patient feedback. What are some of the things and services that survivors need?
I would suggest that if you can, find a good support group, a stroke support group, because it provides an opportunity for you to hear about other strokes and physicians or speakers who are coming in, and there's camaraderie. Some of the problems that stroke patients have, of course, may be mobility. Not just mobility in their inability to walk around, but in many cases they can no longer drive.
Right.
So that's other factors that we need to think about. And it's also good to, if that particular person's stroke is severe enough, or not severe enough, if they've had a stroke, to have a good caregiver, whether that caregiver is someone in a nurse or a family member. You know, that's always something that can benefit that particular stroke person. And that particular person can also help them track their medications, their doctor's appointments, and so forth. You were talking about about getting to the hospital in time.
Right.
And one of the major reasons that you really want to get to the hospital as soon as you have any of those symptoms that Dr. Gabafini spoke about is because there is a short window of opportunity for you to get a clot boosting drug. And that's something that will save your life if you're there in time. So, and another thing I wanted to also add is you're talking about a high blood pressure and getting your blood pressure checked. Do not overlook your pharmacies because most of your pharmacies have a blood check kit. If you don't know how to use it, then there's always someone there that can help you. So, and if you have any questions about any of your medications, or you talked about interactions or symptoms or it not doing its job, give your pharmacist a call.
Absolutely.
Ask him, talk to him if you can't reach your doctor.
We have about 45 seconds left. I want to make sure we give people information on how to contact or find out more about the study, and that's nccompass-study.org, and they can get more details on this study. Doctor?
I just want to say something also. I really have to give due diligence to Dr. Pamela Duncan, who heads this program. and her
Okay.
team at
All right.
Wake Forest Baptist
Absolutely.
Hospital.
Thank you both so much for being with us. That's it for this week's Tar Heel Talk. I'm Sonia Williams. We'll see you again next week.